Hello and welcome to another live stream from Spectrum Healthcare. You might notice that I'm not actually at Spectrum Healthcare at the moment. I am at home. And that's one of the things that I want to start off with is that we are all doing our part at Spectrum Healthcare to make sure that our patients and our staff stay safe and healthy during the pandemic. So as we are working on social distancing and wearing our masks, one of the things that is also important to mention is that our staff has gone through its first round of vaccination. As we are all forward-facing care providers, we all interact with patients on some level. So we anticipate our second that will carry the immunity and be able to maintain health and our services for our communities and for those in need. So please do your part and make sure that you're wearing your masks and doing social distancing and protecting your health and everyone else around you. It's vital that we all do this together. We can't have dissent or disagreement about the scientific facts. We know how to prevent the spread. We know what we need to do. We owe it to one another to move through this as quickly as possible with not seeing any more deaths or new infections. We just have an obligation as a society and as people and as families to do what we can. So with that said, what we'll be focusing on today is an overview of our Wavelength Health Plan. So a little over a year ago, actually it's been more than a year ago, by a lot, we started talking about what we were seeing in the healthcare landscape. We saw more and more working individuals who were unable to afford company policies because companies weren't in a position to offset the cost. We saw more and more individuals moving away from the Affordable Care Act and the policies there because the rates or deductibles or security that provided was in question. We saw more and more people deferring the costs of healthcare and putting themselves at risk for a greater impact. And we knew we had to have some sort of response to that. So we went about seeking out grant funding and programmatic creation to ensure that we could help those that are most affected and most marginalized within our community and have no way to pay. But then there was this middle group, a group of individuals that we knew had income, knew needed healthcare, and knew that they wanted to be engaged because being healthy meant that their homes were stable, their jobs were stable, and that they were able to contribute to the communities that they lived in. So that's where Wavelength grew out of, is this knowledge that we had to have a response. We had to provide something to the community that was meaningful, that was responsive and flexible, and brought to bear all of the resources that the organization has collectively. So Wavelength Health Plan is at its core a concierge healthcare delivery system. And what that means is that for a monthly fee, you have access to our providers. And concierge medicine across the board looks very much the same from location to location. What you have to sort out is all of the other resources that a location is able to provide you. The basics are all the same. Basic annual blood work, physicals, urinalysis, blood glucose, cholesterol testing. I'm reading off our list here because it is a lot. Metabolic panels, blood counts, basic chem panel, all of those things are included and would be done in routine lab work when you go and have your annual physical done. We also, because of our history and what we continue to work on, will include STD, STI testing for HIV, chlamydia, gonorrhea, and syphilis, because those should be routine parts of your annual exam. And so those are all included in all of the plans that we offer. We also will be working to ensure that all of our Wavelength enrollees are eligible to get their flu shot. So that is part of your monthly fee. Some basics. So how we have this constructed is that there are 3 plans. There is a basic, a standard, and a premium. And the basic plan covers your bases. If you are a healthy adult and just need to know that you have a place to go when the coughs, colds, sniffles, rashes, all of the stuff that can occur or may occur in the course of a year, you have a place to go. Someplace where you're not going to be hit with high deductibles, someplace that you know is going to be able to work with you in your current situation, is going to be able to work with you on scheduling through either a physical visit or telemedicine. So that basic plan at $50 a month covers all the things you need. That includes 4 annual visits. And those annual visits can be for a variety of reasons, but we do want one of those visits to be your yearly physical. 6 visits for under telemedicine. So once you establish care with us and you had your initial visit, there are a lot of things that our practitioners are going to be able to cover with you through telemedicine. Once we establish your basic metabolic state, blood pressure, all of that, if you call in and can describe the symptoms of a sinus infection or a cough or a cold, our physicians and nurse practitioners are well versed in asking the necessary questions and getting to the root and being able to help you without a physical visit necessary. Some of the other things that are included in all of our plans are referrals to our specialized partners. We have done the work of negotiating lowered rates with multiple different providers, be that x-rays and imaging, be that laboratory services for things that are outside of what we cover. We have gone through and negotiated better than cash pay rates, because as a not-for-profit, we realize that the people who are going to most benefit from these services are people who don't have a lot of extra income to foot the bill for exorbitant medical expenses. Let's see. You also are going to be able to be referred to other specialties. So we have within the organization integrated behavioral health and support groups and education that you would be able to access as well. And all of these things are included in all of our plans. Our standard plan is $70 a month. That's 6 visits a year, 10 virtual visits, and all of the things that are included in the basic plan. And then we have a premium plan for $100 per month. And that really is an expansive product that is closer to commercial insurance, where you're looking at your billables, you're looking at all of the other services, unlimited office visits, unlimited telemedicine, integrated behavioral health services are included with that. So the basics of integrated behavioral health are that if you have a health goal that you're trying to achieve, we have someone on staff who is charged with helping you plan out how to get to that goal and helping you be accountable. But it's really about you as the patient and what you need to do to be successful, not us telling you what you need to do, but you telling us what you need to do to be successful. So whether that is diabetes management, hypertension management, weight loss, stress reduction, controlling of your anxiety, all of these things can be mapped out in a plan. And if you walk the steps that you know you can achieve, you certainly are going to have better outcome in the long term. Some other things that we're working on as we get enrollees and find out what our participants are most interested in, we will do the work to look at things like discounted gym memberships, nutritional services, so working with a nutritionist, expanded mental health services, so that we can do the deep dive into supporting mental health across the spectrum and long term. So we didn't want to build too many of those things in, assuming that our patient population is going to want or need those things. So we are prepared to add those once we get feedback from our enrollees. Now, the plan has been open for 2 months now, but it's been essentially a secret that it's been open. We wanted to make sure that we opened enrollment, fielded questions through our social media pushes that we have been doing, and learn a little bit more about what individuals want so that we could modify before we do this major push out. And we also want to encourage individuals to enroll early, because we anticipate that once we start targeting businesses with this plan, the total number of enrollees will go up fast. And that could have an impact on how long it takes to get an initial appointment. Initial appointments are a little bit longer. We have more to cover. We have more history to cover with you. So those initial appointments take a bigger chunk of our scheduling time than just a routine follow-up visit or a visit for whatever you need to be seen for. These things are intended to be affordable, but they are not intended to be insurance. And that's an important distinction. Concierge medicine is not a replacement for a hospitalization plan or catastrophic healthcare coverage. It's intended to provide comfort and safety net for individuals who may have zero access to coverage and need some entry point, because those individuals are going to work with our navigators that are on staff. Those individuals are trained in how to assess income and what your available insurance options are. Are you going to be part of the pool of the expanded Medicaid in Missouri? All of those things, and lots of questions and lots of hard systems to navigate. And we have staff who are there to help you through that. So those who are completely uninsured, we want to make sure we are finding all of the resources for you so that you can have an insurance policy that covers major things. Obviously, if an individual has a chronic illness that puts them at higher risk for a heart attack or a stroke or any number of serious health conditions, concierge plans aren't designed to cover that. Those are traditional insurance plans, because the cost of delivering that care is exorbitant. And we can also help you plan for those events so that if something happens, you aren't caught off guard. There's a documented plan in place so that you can move forward without having to fear, financial ruin in the process. Concierge medicine is also a great add-on to plans that have really high deductibles or limited pools of physicians. Adding this to your regular health insurance, excuse me, adds to what you're able to access and how much out of pocket you're really going to be hit with. So if your employer offers you a very basic healthcare plan and they're subsidizing that for you, adding even the basic plan could be a substantial savings over the course of the year, rather than be hit with a $5,000 deductible and have to pay for services out of pocket. So you're never really utilizing your employer-based insurance, but it's there in case something big happens. So again, this plan is intended to provide entry point, to provide necessary connection, and to provide comfort for as long as you are connected with the agency. One of the other things that I think is important to note is that Spectrum Healthcare is a not-for-profit organization. So all of the expense that we calculated for delivering care is how we based our price structure. This isn't about accumulating cash or generating profit. This is about covering the cost of providing care. And that's what we've done. We've calculated that out. We know how much each visit costs. We know what that looks like. So we can keep our system going and engage more individuals and ultimately take this plan and expand that out and really make a difference for those who don't have options in the healthcare spectrum. As you can see on the bottom of the screen, if you have questions, if you want to talk through your personal situation to see if this plan would be a benefit to you, we can certainly set up a time to do that. Our interactions would be either through email or over the phone or a virtual visit. We're not taking in-person visits right now for the Wavelength plan setup. All of that's done remotely. You could still come and see our providers in person if you needed to, but our administrative side is working in the virtual world. So please be aware that you'll be asked to schedule a Zoom meeting or Microsoft Teams meeting with us if you want to have a face-to-face conversation. Over the rest of January and February, our open enrollment for individuals will continue. And then starting in March, our business enrollments will be pushed out. So I encourage you now to contact us and enroll and catch the wave. It's going to be an amazing way to protect your health and control costs. So thank you for joining me today. We'll be back on live tomorrow at 2:00 talking about our chronic disease self-management programs and positive self-management programs with our two instructors for those courses. So please join us on any of our platforms, Facebook, Twitter, YouTube. Hopefully LinkedIn will be coming soon, where you can join us there for these live broadcasts. And this is something that we're going to continue doing, is having these conversations and engaging the population so that you can put a face with the agency and start to feel more comfortable with us and know who you're interacting with. It's really important to us that we create safe space and provide culturally competent care to all of the communities that we serve. So thank you for joining us today. I look forward to hearing from you. Have a great rest of your day.